On media freedoms and access to vaccine information, a panel hosted by Internews. Without further ado, let me turn the floor over to Rowan Reid, Asia Projects Director at Internews. Rowan, the floor is yours.
Thank you, Dr. Robin, and welcome everyone to this session where we're looking at media access and the vaccines. As we've all been hearing over the last couple of days and this morning, governments by and large across the region have come to the decision that vaccines are really our only pathway out of COVID-19. But many people within the community are still quite sceptical and hesitant when it comes to the use of these vaccines. And much of that has been driven by conflicting information. So today we want to discuss the role of media in providing good information, building trust, and also look at where censorship has played a role in coverage of the COVID vaccines. First, I'd like to quickly introduce our guests. We've got Sonny, Inbaraj, Krishnan, who's the Regional Health Advisor on COVID-19 for Asia for Internews. He's based in Cambodia. Then we have Pravit Rojanaphruk, who's the Senior Writer at Khaosod in Thailand. Then we have Agus, Sudibyo, who's the Head of External Communications and COVID-19 Focal Point at Dewan, which is the Press Council of Indonesia. And last but not least, Dilrukshi Handunnetti, who's the Executive Director at the Centre for Investigative Reporting in Sri Lanka. First, I'd like to go to Sonny. And Sonny, in your opinion, how well has the media covered the pandemic and also the vaccine rollout?
Okay, thank you very much, Rowan, Asia, our Internews Asia Projects Director, and thank you also to the Asia Center, Dr. James Gomez and Dr. Robin Sharma for facilitating Internews to host this forum. Thank you very much. Now, in my response to your question, Rowan, the Cambodian government has made Chinese vaccines a key plank in its immunization program. And it is true that inactivated vaccines produced by Sinopharm and Sinovac are less effective than the mRNA vaccines produced by Pfizer and Moderna, but the Chinese-made vaccines have helped reduce hospitalizations and death rates in Cambodia. Now, even more so when the Delta variant of COVID-19 continues to circulate among the country's population. But what is very frustrating for us journalists doing in-depth stories is that the efficacy rates of these Chinese vaccines in phase 3 clinical trials have not been published by the manufacturers in China. So when we get questions from the public asking such questions, I've got comorbidities, I've got type 2 diabetes, I've got a heart problem, I've got hypertension, or I've got asthma. So is it safe for me to take these vaccines? And this is something that we are struggling to inform the public. Now, and neither has been the data been published by the manufacturers on the effectiveness of these vaccines when challenged by variants of the SARS-CoV-2 virus. So basically, I think we are being stonewalled. And when the vaccine regulatory authorities are questioned on the data and the safety of the Chinese vaccines, those journalists asking these questions are accused of trying to promote vaccine hesitancy in the community, which is totally ironical. What we want to do is to be able to tell our duty and inform the public that these vaccines are safe. Now, let me give you an example. Chinese journalist Shen Kai-dong was subsequently deported from Cambodia for publishing a story deemed to be fake news, in which multiple Chinese nationals were reported receiving a text on their mobile phones saying that the Sinopharm vaccine will be offered to them for a service fee. And now authorities also have prosecuted at least 3 individuals under the new COVID law for posting on TikTok videos criticizing the use of Chinese-made vaccines. So in a nutshell, to summarize, we want to do our work. We want to inform the public that these vaccines are safe, but we need data to convince a skeptical population, and we're not helped in that work. Thank you.
Thanks, Sonny. Kun Pravit, how's the situation been in Thailand, and what's your sense of the coverage? Has that been effective in changing people's attitudes towards the vaccines?
Thank you, Rowan. Well, in Thailand, the story is quite slightly different. Let me start with the stats very briefly. So far, I mean, Thailand has been doing fairly well until the current outbreak, which is the Delta variant that began after or soon after April, so probably May, and now it ranks amongst the world top 30 in terms of the number of accumulated number of infections as well as death. So we're talking about 1.3 million people out of a population of around 70. Deaths still, I mean, low compared to maybe Indonesia, but the combined death is at 13,000, just below 14,000 now. Okay, today's death, I think it's just below 200, maybe 170 or something. But let me just start by then saying that about 2 months ago, the government tried to ban the disseminations of news as well as opinion on social media, and try to criminalize any such information that may create panic and fears regarding the COVID-19 situations. Okay, and even if it is truthful or factual. Okay, good news is they failed. A group of media organizations and journalists have challenged the government and brought the matter to the court, and the court ruled that despite the fact that they have an emergency decree power, which has been imposed for over a year now, and actually later today we may know if the government would finally lift the emergency decree, which is a COVID-19 emergency decree, which amongst others ban gathering of more than, it used to be more than 5. It has been relaxed at the beginning of this month in the heavily infected provinces, which includes metropolitan Bangkok. Now it's 25, so it affects political rights and all that, but basically that was opposed successfully. So we're talking about that sort of environment. And to make the matter worse, and let me get to the Sinovac thing, which is more interesting. I would say it's more interesting in Thailand than in Cambodia now, because the Thais have a more ambivalent, positive, I mean, generally, but ambivalent attitudes towards not just China, but the vaccine. In Thailand, we do have stats. The local hospitals, some public hospitals have conducted tests comparing the efficacy of Sinovac vis-a-vis AstraZeneca and a few Pfizer that we have managed to secure, okay? And it's unfortunately, Sinovac is much less effective than AstraZeneca or other mRNA vaccines, okay? And so we have that statistic. It's not being suppressed, although the government have warned some people and groups not to devalue Sinovac, okay? Okay, the government warning the Thai people and the press, and I get it. I mean, that's fact. I mean, they can say whatever they like, but the Chinese have taken an unprecedented move on Saturday, 6 days ago. The embassy spokesman issued a statement by social media, including their much followed Facebook page, basically condemning any people in Thailand who are trying to devalue Sinovac. Okay, and I need to read this, and actually it's for my column tomorrow, but so it's in Thai, but I'll read the English versions. Okay, so bear with me, which is very interesting. Okay, open quotation. Recently, some people and organizations have devalued and slandered without reasons and attacked with no respect to scientific information and fact, on the Sinovac vaccine. It's an assault to the good intention of China in supporting Thai people's fight against the pandemic. The Chinese embassy totally opposed this and call on related people and organizations to cease the severely wrong actions. End of quotation. This is just part of that statement. So it's a very strong statement. Some people are now asking, is Thailand a satellite state of China? Okay, I don't want to get into the politics, but Thailand's are very sensitive, partly because, we have a long-standing good relation with China, and many Thais have or can cite their Chinese ancestry, myself including. But it's a very uneasy situation when Sinovac, which is privately produced, okay, it's not like a government-produced vaccine, are now being defended by the Chinese government. And on the following day, an ultra-royalist group staged a small demonstration to apologize to the Chinese people for all this criticism, because there are a good number of Thai and a good number of Thai Chinese who have basically lost faith in Sinovac. Well, they call it Sinocrap in Thai, okay, but that's Sinocrap is in English. So basically, some said it's as good as injecting yourself with a saline solution or something, okay. So my point is this: the debate has taken to the extreme. Let me openly state that I had no choice. We and some other Thais were early on were vaccinated, and there was no choice. So I'm still alive. Let me just say this, and uninfected after 2 doses of Sinovac. Okay, not that I could choose. Okay, the choice back then, back in I think when was it, May or something, was either Sinovac or nothing, because the AstraZeneca, which was locally produced by a Thai company, Siam Bioscience, which is owned by the crown or the royal family or the king, basically, did not manage to turn out as many doses as we had earlier expected. And that's another scandal. Okay, that scandal, before I get back to Sinovac, is a real problem because the Thai press are very hesitant to fully scrutinize the company Siam Bioscience, which is producing, it's the sole manufacturer of AstraZeneca, and they failed. And AstraZeneca also having their own problem delivering vaccines to the world. So, the target from something like 10 million per month, 10 million doses per month have been cut. And now we're talking about something like 5, and people feel even fortunate if they manage to get 5 million doses. So basically, Sinovac became the main vaccine for Thailand over the past 4 or 5 months. And now China is entering. There are people like this, people who demonstrate, 2 of them holding placards, thanking China, apologizing to Chinese people, and said they speak on behalf of millions, if not millions of Thai. So things are getting pretty ugly, but the press are doing what they can. So I would say it's probably not as bad as in Cambodia, from what I heard from Sonny. So no one is being deported for trashing Sinovac. Okay, people speak freely to the point where the Chinese embassy have to intervene. But I think that interventions are really over the top, and there will be a backlash. People already asking if the Chinese are acting like Big Brother. So that's my presentation for the first round. Thank you.
Thanks, Pravit. Well, let's go to Indonesia and Agus. Mas Agus, it's interesting. You represent the Dewan Pers, which is the press council there, which is sort of responsible for not so much regulating, but keeping an eye on what the media is doing there. What's been your observations of the media and the way it's handled the coverage of the vaccine?
Thank you, Mr. Rowan, and thank you, Asia Center. I would like to share Indonesian experience, how the press, mass media, make some collaboration with government, with civil society to countermeasure of COVID-19 pandemic. I hope I can share this presentation not more than 10 minutes. This is the problem of COVID-19 countermeasure in Indonesia today. The main problem now, I think, euphoria, public euphoria after the decline of COVID-19 second wave. If you go to Jakarta or another city in Indonesia now, you can say that people tend to rashly feel safe. They go everywhere and tend to neglecting the healthy protocol. They tend to forget the importance of use of masks, make social distancing as should be. Another problem is the amount of vaccine is still limited. Until now, only around 33 of national population of 274 million have been vaccinated, and the vaccination is still focused on Java Island or urban areas. And another problem is discrimination, because number of state officials have received booster dose while many people have not received even the first dose. And some people still object to vaccination due to religious reason or anti-China sentiment, and some small group of people also influenced by hoax that spread on social media. And what the press try to do now is to make balancing between supervising the government way dealing with pandemic while keeping people hopes that pandemic can be overcome. This is not easy task, and the press is facing dilemma, because we know that excessive dramatic news reporting actually incite public fear and anxiety. But in the same time, we consider that we need to maintain scrutiny, critique to government when necessary. And in the same time, mass media in Indonesia also try to serve as a hoax fact checker, because there are too many circulating hoaxes that affect the public acceptance of vaccination program. But in this situation, I think there are not many opportunities for government to blocking the flow of information. There is relative no obstacle for the press to convey the facts on critics. Public scrutiny is very dramatic, very dynamic in social media in mass media coverage. And for example, the press and social media continue to criticize state officials who receive booster dose. And if the decline of media reporting quality happen, is more due to the limit mobility of journalists to cover and access pandemic event amidst the enforcement of work from home policy. Remember, the Indonesian press is also experiencing hard time due to the pandemic. Many media companies have closed down operation and some journalists have lost their job. But fortunately, in this crisis period, it is very important to note something that's rarely happen in Indonesia, which is collaboration or reciprocal support between government and mass media facing the COVID-19 pandemic. For example, mass media continually conduct national campaign for COVID-19 spreading prevention. Mass media organized by some media association conduct pro bono public service advertisement and still running until now to campaigns the importance of public healthy or healthy protocol or COVID-19 protocol in daily basis life for everyone. And another project that Indonesian Press Council and Journalist Association join with government conduct journalism fellowship program for countermeasure of COVID-19 pandemic. Started October last year, this program recruit around 4,000 journalists nationwide to cover stories related to the pandemic with the perspective of positive behavioral change for countermeasure of COVID-19 pandemic. The fellow, the journalist that became a fellow in this program, received incentive around $184 per month. Not really big, but it's important as the scheme to prevent or reduce of media layoff effects. And journalists will remain working at their respective medias and still free to criticize government every day, to criticize government way to dealing with the pandemic. This is the condition that submitted by Press Council when government offer us this project last year. The fellow will be also directed to serve as a contact tracer, tracing individual who may have possibility infected by COVID-19 virus. Another condition for Press Council for this program is involving 29 senior journalists from credible medias or journalist association as editor for this fellowship. Another project, we also organize a vaccination program for media worker in cooperation with Minister of Health, Minister of Communication and Information, local governments, as well as press organization or journalist association. We conduct a series of vaccination program for 42,000 media worker, not only journalists, during February to September this year, especially in Greater Jakarta area, the capital city, and also in the capital of province. This program still running now and will continue after the condition is much better for media or journalists. And last year, Press Council also conduct a series of PCR tests for journalists, and still running now. And I think it's also important. So we need more collaboration and reciprocal support between government, civil society, private company, and also journalists to dealing with this pandemic. And it is what we try to do now in Indonesia. This is my presentation. Thank you.
Thanks very much, Mas Agus. Let's go to Dilrukshi. Dilrukshi, what's been the situation, what you've experienced in Sri Lanka?
Broadly, Rowan? Okay.
Yeah.
Okay. So actually, listening to Agus, I felt sorry for myself because he spoke about the kind of collaborations that have taken place, and that's really important because we come from a place where we have no reference point when reporting on COVID-19. So journalism, it's not like SARS or MERS. You have really no reference point to really go back and dig up stuff and understand what it is going to be like in the next several years. So journalists. As an organization that works with journalists, my experience has been, I've seen how the newsrooms getting stressed. Earlier, health and environment were not very important beats. Often, we come from a country that had seen conflict for so many years. So suddenly there is a pandemic and you are suddenly required to have a new skill set. So I think that's when, the kind of role you play in promoting greater understanding on vaccines and its efficacy. That whole literacy aspect becomes extremely important because journalists actually don't know. So they come from that point broadly, but the newsrooms are full of COVID stories, and how do you report that? So I've seen one of these as a key issue faced by the journalistic community, and oftentimes the top priority request for training was that. So that's one of the things I observed. And the second thing is disinformation and misinformation. It cuts both ways. You see, journalists can be good communicators, promoting key messages that are relevant to public health and promoting public health. But at the same time, you can also join the government's bandwagon and be those people, the rumor mongers, talking about traditional cures. We actually, in 2020, journalists were largely contributors to all kinds of peddling of hoax theories. Where there was, if Sri Lanka showed vaccine hesitancy right at the beginning of the pandemic, I think it's definitely the government's doing, because they were talking about home cures and native knowledge. Not to undermine native knowledge, Asians have a lot of it. And but still, whether pitted against the efficacy of a vaccine, whether it can actually protect lives, is something that we should have debated. But there was no such thing, and instead, all kinds of concoctions were being, we had all kinds of concoctions being introduced during primetime television, and then from the Speaker of the Parliament to a Minister of Health, the former Minister of Health, would bring this up to show that this is the way to go. So in a situation like that, where, the integrity of the information loses its value, and then it becomes very difficult for journalists who are also taken up by this theory of, so we saw a lot of health disinformation that was promoted and that was done by the government. And more than promoting a particular vaccine from a particular country, we saw generally this happening. And then, of course, the militarization or the securitization of the process. Who can manage it better, whether it's the health authorities or whether it's the military? Undoubtedly, military runs in a certain way. So where they ran vaccination centers, there was, it was better organized. I also went to one and I got vaccinated. So I saw it, just 3 to 4 minutes. But the government-run places were a lot more chaotic. But this was shown as, you have no order. The public service has no order. The military has order. So this has been, there has been, this mainstreaming of this idea that systems are better run. So the health services are also better run if you have more militarization, so to speak, if that's the way we manage it. So anyway, our response is led by the military, the Sri Lankan response. So last year, it was pretty good, and we showed good results. But right now, Sri Lanka has really high fatality. Our fatality rates are really, really high, between 180 to 200 a day. And this is a 21 million, our population is just 21 million. And as of today, 10 million people have taken 2 doses and been vaccinated. So you have, Rowan, all very, it's like a jigsaw puzzle that cannot be fitted in. You have the good things, the bad things, the good, the bad, the ugly, and it's very difficult for journalists when they have never been put on a path, like what Agus said, where you actually have a process where you can actually discuss efficacy, discuss about various different vaccinations, who sends what, why are we focusing on one, and which area gets which particular vaccine. So that's another thing. This information has been quite, if you in the rural areas, there is uneven distribution. You just get vaccinated and you don't know exactly what you're getting until you go to the vaccination center. Is that okay? Should we be making, so I was listening very carefully to Sonny about, the kind of choices we have to make about getting vaccinated. I'm asthmatic, so does it work for me? Or someone with heart disease, does it work for someone else? Should this, should this not be general knowledge? Should there not be discussions? Use of public forums. I would think that's the role of the government to talk about efficacy, talk about what works and what works with our DNA to start with. And that kind of information was not available. And if you were questioning the government's program on on vaccination, the having created vaccination hesitancy in the first place. Now suddenly in this year, that was last year, this year we are in this phase where we really want everybody to be vaccinated, and we want to be one of the leaders, the pioneers in Asia to get 100% vaccination done. Now this is our deal, and our president keeps saying, like, we did it well and we are the best. So it's like, it's a joke in this country right now, how he goes about saying that. But now the focus is on that. So you created hesitancy first, and now you want the journalists to join your bandwagon and say, oh yeah, all of us get vaccinated. But what is the process of sharing information? In speaking of information and the way in which the systems are managed, we have had top health officials resigning in the past several months. And doctors have been hauled before the Criminal Investigations Department to record statements as to why they made public statements about the pricing of certain kits, and so pricing and the entire handling of the pandemic. So there was so a couple of doctors, this is the first time you hear that public health officials have to go and record statements for public statements made in the public interest. So public interest, what does public interest mean? Do we just follow the dictates of a state and we do not question? Is that the role of the journalists? Is that the role of the health authorities? And we definitely don't think so. And now if this happens within the sector, the doctors are becoming, doctors were sharing information on Facebook saying this particular hospital needs this kind of support. What's wrong with that? Should they be questioned for those posts? isn't that the duty of the state and the health authorities to go check whether this is true or not and address that issue? Because we're talking about people having access to vaccination and also facilities. If you're sick, if you have tested positive, you need to be treated. So if the hospitals cannot manage the case load, shouldn't doctors be talking about it? So that's happened. And on social media, we have had situations where people who shared information have been arrested, taken in for questioning. We've had at least 16 cases so far since last April to this year. We do not have the laws that are directly dealing with what we call false content online or fake news, but you dust up all laws. We have these, archaic British relics that we keep. And so they have very interesting words like creating panic and exciting dissatisfaction. So from the police ordinance to the penal code, you have these phrases and they get interpreted, and the Computer Crimes Act has been one good tool to be used when you go after social media users. What happens is, cumulatively, when this kind of thing happens, people want to be silent. People know there has been a silent message that you're supposed to be silent, not be questioning. And just a couple of days ago, a colleague of mine who questioned as to why tourists can come without, if they have been vaccinated, they have got both doses. And if you carry the certificate, and if that is, if should they be wearing the PPE when they arrive in Sri Lanka? You have the tourist board authorities saying, oh, you don't need to wear the PPE as you arrive if you have been vaccinated. So just for some tourists, are we compromising our health? Is that something that we can handle with this kind of infection rate and rate of deaths that are daily deaths of close to 200? I'll stop there, Rowan.
I'll stay with you there, Dilrukshi. How willing has the media been to criticise the government? You said that the government was spruiking a lot of unusual therapies for COVID, and probably did a lot to increase vaccine hesitancy. Were the media willing to criticise the government in that period, and even now that you bring up all those other challenges?
Initially, no. We really didn't see that much of questioning. Of course, there are questioning journalists everywhere, but I think as a government, and you also know, Rowan, how the Sri Lankan media runs, and there's so much politicization. There's great affiliations to the state, so that creates that creates a backdrop in which all the media organizations are most likely to repeat themselves. There is never really a different narrative that will be coming out. So all these soothsayers, all kinds of people who create these concoctions, they were occupying television studios, primetime television studios, studio time to talk about these things and saying that this is the thing that works. And it was okay. And when we were doing health disinformation related work, we were the unpopular ones because we were actually opposing that viewpoint, saying, think about public health aspects. Does this work? Yes, it may be boosting immunity. We don't question that. This is not to say that there is nothing called, local traditional knowledge. There is, but what we are saying is that you need to be vaccinated, and that's something that you should be thinking about. So these two things are different. Boosting your immunity as opposed to being really protected as much as possible through an effective vaccination program. So by the time they switched, by now, journalists are very hesitant. They're generally hesitant to accept the government information. For example, when they say this area was vaccinated fully, now people don't believe it. This is the problem. You have lost trust. You obviously lose trust if you take this path. And now when you say that this is the number of deaths, if people think, oh, no. So either you count the dengue deaths also in it, or you also do not do the documentation right. Why does it happen? But the good question would be, what is the role of the journalist then? Should you not be checking out what exactly are these deaths? What types of deaths? And to do that, where is the incentive? If you are likely to be question if you end up going to, having to record statements with the criminal investigations department. And that is the kind of fear people may have. Having said that, there are great journalists doing great work out there, still discussing the public health message. It's not over yet. But what I'm saying is that the atmosphere is not very conducive for independent, in-depth reporting where people can actually look at as to what's going on. Are the numbers right? Why is it that we don't have enough information? Why is it that we don't have enough information about what kind of vaccination goes to a particular area? For example, in central parts of Sri Lanka, Moderna was the only one that was available. And when people started showing side effects, there was no conversation. And there are lots of questions about it. And it's not to, not to just talk about one particular vaccination, but what about people's experiences? Who's recording this? How do we monitor what people are experiencing? And I know in so many other countries, the authorities are actually recording people's experience post-vaccination, because it's important. If we are going to improve the vaccination process, you have to understand what happened on the first day, the third day, the 7th day, and the 10th day, and the 14th day. And there has to be a systematic way of recording this information. We don't do that. And this database is going to be the most important one for ensuring public health in the coming years.
I think that goes a lot to what Sonny was saying earlier about the lack of data that he was experiencing in Cambodia. Sonny, let's go back to you. A question from the floor. Given the monitoring of content over social media, I guess that is, do people feel safe or able to articulate their concerns about the Chinese vaccines? And are people exploring other non-Chinese vaccines outside Cambodia?
All right. Thank you, Rowan. I think Cambodia has got in March passed the new COVID-19 law, and basically let me get the details of it. And this law allows for 20-year prison sentences and other disproportionate penalties for violations of COVID-19 related measures. One thing in the law is that you can be imprisoned or punishable by up to 5 years in prison for the obstruction of COVID-19 measures. So basically questioning the use of vaccines, or questioning the government's use of vaccines, and trying to create a debate on whether these vaccines are safe, could be deemed as obstructing COVID-19 measures. And people are really freaked out. And the government is using this law actually to go after the opposition CNRP cadres who have been posting these questions on Facebook. Dilrukshi brought up some really important points that are really applicable also. The questions are really applicable for journalists in Cambodia. This whole thing of excess deaths or excess mortality. Each time we get on the average now about, on the average previously about 20 deaths a day. Now the deaths have gone down, but the number of death cases are going up. As of yesterday, there were over 3,000 cases of COVID due to the Delta variant. Now, when questioning the deaths, are these deaths due to COVID, or are these deaths also, it's the dengue season. So the symptoms are the same, body ache, fever, and people die from dengue in this country. So are the deaths being confused with dengue cases? And also with regard to the new cases that we see every day, journalists have tried to question whether the new cases are due to vaccine breakthrough cases, meaning people who have been vaccinated after the full dose of two doses. Are they getting reinfected again? So we're not getting these questions. Yes, we know Sinovac and Sinopharm prevent deaths, but the new cases that are coming, are they vaccine breakthrough cases, or are they separate infections? Which is something that if you're a health journalist or a science journalist, you would want to ask these questions. So if you post these questions on social media, it's really, you're asking for trouble, actually. And you could have the special branch knocking on your door, and journalists have been questioned. Why have you been posting this on social media? Internews works with a lot of community journalists, or CJs, and CJs are also more vulnerable than mainstream journalists, because they don't have a media organization to protect them. These are individuals giving stories to mainstream media. So yeah, it's a dicey situation. The Cambodia, we've been reading a lot of stories. Cambodia's vaccination is a success. Yes, it's a success because it's a small population, 16.5 million people. Coercion has been used to vaccinate people. If you're not vaccinated, you can't send your kids to school. If you're not vaccinated, you can't go back to your government job, especially if you're in the military or working in any government departments. Yes, it's justifiable for frontline health workers to be vaccinated fully because they're dealing with the cases, But what about people in the informal sector? We have a lot of people here who are working from day to day, and almost, they find it very difficult actually to keep up with the vaccination appointments, because these people, like, if they don't turn up for work that day, you don't get paid and you can't feed your family. And here you have like people waiting for hours at the vaccination center to get vaccinated. Now, of course, they've cut down the time because of, because of complaints from the public and complaints also from these poor people. But the fact remains, if you're marginalized, you're poor, you work 3 jobs to try to make ends meet, how can you keep up with the vaccination? How can you keep up with a directive that you have to turn up with the vaccine at the vaccination center at this time, at this day? If not, you don't get the vaccine at all. And then you go back again to the queue and go through the whole rigmarole of paperwork and all that. So something, if you want people to take the vaccine, you have to have measures to be flexible for these marginalized people. And lastly, I think also to reflect on what Dilrukshi said, I think more and more, and this was brought up really well yesterday at the Asia Center panel on securitization of COVID-19. We're seeing now, like, the whole securitization, the whole role of the military, and, it brings back to mind, this book that I've read by Alex Dewan, saying the title of the book is New Pandemics and Old Politics. We are seeing we're seeing responses that are very medieval, responses that were, in the Middle Age, that states used in the Middle Ages to try to control the bubonic plague or cholera, and then using really draconian measures, using the military, using the security apparatus. And now we are seeing a repeat of it. what has happened to community engagement on trying to get people to voluntarily and wholeheartedly embrace something which can protect them and can save their lives? They don't have to use coercion. And I'm quite dismayed by that. Thank you.
Thanks, Sonny. I think there's been a lot of picking up old ways throughout the pandemic, and some of those measures have been extremely harsh. Pravit, a question from the floor for you. What is the role of Chulalongkorn University and its vaccine? Is it another making venture for Chula? You're mute there, Pravit. Khun Pravit.
Yeah, sorry. Thank you for the question. Well, the Chulalongkorn University, which is one of the top universities, are currently trying to come up with our own locally produced vaccines. Okay, and well, my hunch is, unfortunately, they've been very slow in trying to human test. I think they just recently announced and are trying to get volunteer to do the human testing for the vaccine. But well, we're keeping our fingers crossed. I'm not a medical expert to be able to comment, but I think there are sufficient grounds to believe that there might be a breakthrough, and I think the government needs to give its full support. But at the same time, we need to hear more details about the related information, whether this is a serious and very viable project or not. Okay, but you know, I'm talking about all this informations, and I heard a few other speakers casting doubt. In Thailand, generally, I think the government have been doing, I would say I would give them a passing grade in terms of communicating. Okay, we're talking about communicating, not controlling the disease. This is almost a daily press conference. We get stats updates every morning. If there is any area where there's a lot of doubt remaining, is the number of those infected, because the level or the number of those tested are still very low. Okay, it's around 46,000, and over the past 2 or 3 or even a month, the number of those infected, even now, which is the curve is going down, it's still somewhere close to a third. Okay, but we talk about 46K for a population of 70 million. That's very still significantly small. Okay, so people are questioning whether the real infections number is much higher. For the death, I think I have little doubt that it's more or less fairly accurate. Of course, there could be other people who died and not classified as, you know, having suffered or infected, having become infected with COVID-19. But I think more or less it's, I think give and take 10% or 20%, it's more or less accurate. So that's where we stand. I feel sorry for Cambodia. I think the situation in Thailand, in terms of the press relation with, you know, COVID-19, is much better. If there's any concern, is the emergency decree, which has been used to restrict political gathering. And of course, there are a number of Thai who want to see the prime minister resign or oust the prime minister due to the COVID-19 management meltdown.
And tell me, right at the start of the pandemic in Thailand, it was largely in the Burmese migrant community, and there was quite a lot of racist commentary floating around. Has that disappeared now?
It's more or less subsided, and that's good. The first spike, as you have said, Rowan, was, people were more wary about migrant workers illegally crossing the border, particularly from Myanmar and Cambodia. Now, I mean, what can we complain? I mean, the figure in Thailand is worse than Cambodia. So until about a month and a half ago, there was a 1 month what the Thai call bubble and seal and cease of most of the major construction work in Metro Bangkok and some cities with high infection rates. And of course, those who have been more severely affected were migrant workers, because they are now the majority of the construction worker. And it has been most unfortunate, we must acknowledge, that people were kept in a much lower than humane standards. Okay, it's a shanty rooms that they are being kept for a month, not allowed out. Some has escaped, but more or less, I think that narrative or discourse have subsided now that probably more Thais are infected than and Burmese.
Yeah, I mean, that's not unusual, and certainly not limited to Thailand. I mean, similar case in Singapore and also Malaysia, where it was the migrant workers where the virus really took hold and got away from people. So, but yes, it's good to hear that the coverage is now a little more less based around race and more around the actual pandemic itself. Mas Agus, a question from the floor here for you. What is the debate around vaccine efficacy in Indonesia? For instance, what is the role of the Chinese embassy in responding to or addressing the negative sentiment to Sinovac, similar to what Kun Pravit was talking about in Thailand? And in this context, what is your view about the Nusantara vaccine, which is being led by the military there?
Sorry, the second question is?
I'll if you answer the first one, I'll answer the second. I'll ask the second one again once you finish. That must be easier. Okay.
For my knowledge, there are not yet some response, some action for the ambassador of China in Indonesia dealing with public criticism to Sinovac vaccine. Sinovac is the main vaccine that used by Indonesia government for public until now. And yeah, there are some group of people, not only Muslim people, but also maybe we can say intellectual, also expert that have a critical question about the efficacy of Sinovac or Sinopharm vaccine. But finally, people think, like a government think, that we have no other choice. For example, in June and July, when the spreading of Delta virus is very high in Indonesia, and then people in majority of Indonesian people is all still use and agree to be vaccine with Sinovac or Sinopharm vaccine, because actually we have no other choice. And even actually some expert or some public discussion criticize the efficacy of Sinopharm, because there are many people in Indonesia, even they already have a second doses of Sinopharm or Sinovac, they finally they also get the COVID-19, and the number of the people that get COVID-19 after they get a second doses of Sinopharm or Sinovac is quite high. But yeah, I think Indonesian people thinking that they know no other choice. But now we have another choice because another vaccine is come to Indonesia, AstraZeneca, Moderna, and another. But still, the vaccine for China is the majority until now.
Yes, I think Jokowi was the first internet world leader to have Sinovac, if I remember it correctly.
Yes, Sinovac and Sinopharm, I think.
Yeah, okay. So the second question was, what is your view about the Nusantara vaccine, which is being led by the military?
Yes, finally, I think actually, honestly, we have another problem. We have limited medical resort person to do vaccination. Medical resort person to do vaccination. And then I think on the late of June, I think in the middle of July, Indonesian government asked the military body to doing the vaccination program. So police do the vaccination, the Minister of Health doing the vaccination, and military also doing the vaccination program. But until now, there are no serious question for public about the government policy to ask the military body to do the vaccination, in my opinion.
Yes, I think as Dilrukshi was mentioning, and also Sonny, militarizing the vaccine rollout's been something that's happened in a lot of places. Even here in Australia, the person that the government went to was a general to resolve their problems with the vaccine rollout, which I think is interesting as well. A question for all of the speakers, and I'll go back to Dilrukshi here. Vaccine booster, where is the discussion and new reportage on this issue in your countries?
Okay. Thanks, Rowan. Right now, as of today, we have had 10 million people who have had the second dose. So that's definitely 50%, almost 50% of the population. We are just 21 million people. So we have reached that mark. This is according to the epidemiology unit of the Ministry of Health. So there is a discussion, just it's very recent, about the booster and the fact that those who got Sinopharm probably would need a booster within the space of 6 months. And this is an absolutely new discussion, but people do question about efficacy, because seeing is believing. I think the efficacy debate was a little too, it was too academic last year and even in the early parts of this year. And now that you see that the reinfection rates becoming a topic of discussion. At that point, people definitely want to know about the need for a boost and look to other countries as to how they are doing. Of course, there is a reference point, the WHO statement about the rich countries holding back on the booster until the other countries, until everyone gets vaccinated, the first two doses. There is some kind of discussion. It's not a fully fledged one as yet, because right now people actually live in fear. We are under lockdown, and this is the third time, and the rates are the mortality rates are really high. So I think by now psychologically people would appreciate the discussion on having a booster shot.
Yeah, and has there been any talk of the mix and match? Start with a Sinovac or Sinopharm and then move on to AstraZeneca or Pfizer or Moderna or one of the others?
Okay, so Pfizer, yes. The discussion revolves around Pfizer being given as a booster. So that's as much as I got, like the last 2 days when I was trying to dig out some information from the health authorities. That's what I heard. So they look to, for some reason, well, some of it is unofficial. They did say that Moderna was recording more side effects. So they felt there was also some belief that possibly it would be the right thing to use Pfizer as the booster shot. So that's the current thinking in Sri Lanka. But booster shot, I think, is a little far away. It's not going to definitely happen this year. And we still have 50% of the population to be vaccinated. And we also do not have anything available for children yet. And we talk about wanting to reopen schools. So that's a huge concern.
And Dilrukshi, while I've got you there, another question. Is there any news coverage or debate on the role of India in vaccine distribution?
Sorry, Rowan, I didn't hear the last part of it.
That's all right. Is there any news coverage or debate on the role of India in the vaccine distribution?
Well, yes, Sri Lanka is full of health misinformation and disinformation, and there's a lot of propaganda. We all know that in this Indian Ocean Island, little Indian Ocean Island is such a hotbed of, I don't know, for warring factions, and they are all the superpowers in the region. So we have battles for supremacy being played out here, and that's true. So, but clearly China has won the day. There's no two words about it. So there is less, unlike in any other place, there's less questioning of Sinopharm. There was a research that said that Sinopharm was most effective, and people reached a point, and with all due respect to the scientists, and they are the best in the country, still for all, that whole efficacy testing and what they place in the public domain was also questioned, because people think anything Chinese works in this country. And of course, there's vaccine diplomacy, and countries rushing in to support, and different doses, different all kinds of gifts. And at a point, a top Indian foreign ministry official came here to declare support. And this was just when Sinopharm was entering the country. So these things happen, Rowan. It's actually, it would be funny if it wasn't too tragic to watch.
Yes. There's always that. I'm not sure whether it's a friendly rivalry, but there's certainly a rivalry. Sonny, tell me, there's been a lot of discussion about boosters in Cambodia. How is that playing out there?
Okay. For Cambodia, I think the latest percentage of the population, the adult population that receive 2 doses of the vaccine is quite high. Actually, it's between over 75% of the adult population. And now vaccination is happening in in the northeast in areas populated by the indigenous communities and hard to reach populations. Very interesting because I just checked the QR code on my vaccination card. I've been vaccinated with Sinovac, and I saw a third column over there indicating the third vaccine or the booster shot. There's a lot of discussion about it. The booster shot that is being used or going to be used, the third shot will be sometime this month and goes on right to the middle of next year. The booster shot is AstraZeneca, so the government is getting extra doses of AstraZeneca. But some people have already been asked to get their booster shots just for about 4.5 months after receiving their Sinovac shots, the second shot of Sinovac. And I think WHO and also the scientific evidence is there that if booster shots are administered, it should be between the earliest would be 6 to 8 months after receiving the second shot. So there's very little question. I think there's a lot of fear if you question why the booster shot after four months or 4.5 months, and again, you might get accused of, as a journalist, you might get accused of obstructing COVID-19 measures and receive a hefty fine or a jail sentence. So these are the things that we need to ask. And logically speaking, if you say you need a booster shot after 4.5 months of being vaccinated fully by Sinovac or Sinopharm, does it mean that the Sinovac vaccine, the antibodies produced by the Sinovac vaccine last for only 4.5 months? You know, these are valid questions that we as journalists digging deeper and wanting to do a good story have to ask. But sadly, such information is not forthcoming here.
Yeah.
And Cambodia is on track for the booster shots. There's also an option for us if we can afford to get the third shot in the private sector, we can. So now the private sector, there's this hospital, Royal Phnom Penh Hospital, which is importing Pfizer vaccine. So if you want a booster shot with Pfizer, you can get it. Just register yourself in the Royal Phnom Penh Hospital, go to their Facebook page, register yourself, and they'll let you know when it's available. On your question on mix and match, yes, it's happening here. You know, you get Sinovac and then the booster shot is AstraZeneca, or if you can afford it, to get Pfizer from the private sector.
Yeah, great. Thanks, Sonny. Mas Agus, I want to change the question a little bit here. What was quite impressive about your presentation was the reciprocal relationship between the government and mass media. I'm interested to know what more can be done and what lessons can be learnt out of the experience that happened in Indonesia for other countries, so that we all can do a much better job from the media side of things to strengthen the public health messages.
Yeah, I think maybe morally that reciprocal support or collaboration between government and mass media or the press is some possibility. That's it. In Indonesia context now, it's very important because there are so many journalists that lost their job because of media layoff, policy, and so in my perspective in Indonesian Press Council, we try to thinking what should be done to help the journalists so they can still doing their job as journalists, and they get a salary, even not really big. So with this salary, they do their job as journalists. So we try to lobbying the government last year. I think it's not only happened in Indonesia, but as also in another country in Europe, in maybe in New Zealand, in Australia, that in the situation of crisis because of COVID-19 pandemic, some government in different country give economical incentive for media, and we try to adapt this to Indonesia, and finally this incentive we can spread to different things. First is incentive for publisher or media company, and the second incentive for journalists as individual. So the incentive for journalists, and then we use it to conduct the fellowship for journalists. So what government finally give to journalists, not only money, but also program. Journalists have a duty to write, to produce 11 or 12 news for print media, online media, radio, and television. That's a campaign the importance of healthy protocol, use mask, social distancing, was the hand for public in their everyday life basic, and this actually this is the first one in Indonesia that Press Council, Media Association, Journalist Association get this kind of collaboration. And the budget is very big for us, because the budget for this fellowship is bigger than annual budget of Indonesian Press Council. But we also face critic for some people, because how about the independence of media? How about the neutrality of journalists? This is the gray area, but I think until now, the fellow can criticize the government way to dealing with this pandemic freely every day.
Yeah, can they criticize Dewan Pers?
Yes, of course. Please criticize me.
That's all right. Pravit, do you think you could see something like that happening in Thailand? I don't imagine that there would be as much support for something as sort of general and generous as what's going on in Indonesia.
Well, for the press, we are not getting any help. And I think partly it has to do with the acknowledgement or understanding that people in other sectors are suffering much more, particularly those in the tourism industry, for example. people in the restaurant, food and restaurants, the restaurant in Bangkok and some restricted provinces have been shut for, must have been like 2 months, and has been 2 months. You could, for that period of 2 months, you could only order food, takeaway food, okay? And that has been relaxed just early this month. Now, if you run an open air eatery or restaurant, you can put seats for a maximum of 50% of the full occupancy rate. While if it's an air-con, or 75 for open air and 50 for the air-con restaurant. So there are, other people who are really suffering, and I think the press, it's not the worst paid sector in Thai society, but understandably there've been freezing of hiring, freezing of salary increase, as well as some early retirement. But I think for now we're not really talking about that here in Thailand.
Yeah. Dilrukshi, I know that there's been there's been a lot of carnage in terms of staff numbers in Sri Lankan media. Would there be any thought to some sort of universal fellowship or something like that to strengthen coverage and improve the debate around the pandemic?
Well, I think it's something we really should look towards. And like the examples shared earlier, Sri Lanka also had media houses definitely cut down on they were cutting down costs, and this also meant letting go of journalists. Some of them, some people lost their jobs. Mostly getting affected would be the stringers and people who are working from the regions who do not have full-time jobs but are an integral part of the newsrooms. But I would think, Rowan, it's time to boost our understanding of a pandemic landscape, because I really see the jigsaw puzzle doesn't fit. And it doesn't fit for a number of reasons, because our institutions are not ready, and collaborative work needs to happen. And in Sri Lanka, there have been two major discussions around journalists. When you talk about journalists safety, physical safety of being, doing field work, and when institutions do not support but still expect, particularly those who work in the television, they really have to get the footage. So what do? You really have to, you don't have the luxury of sitting behind a computer. So how do you deal with that? And I know of people who lost jobs. These are media workers. They lost jobs because they simply said, like, aren't you going to provide us with the PPE, like even the masks? There is so much that people can personally, invest in. So I think as an industry, we must have a way of telling the story. One thing is to capacitate ourselves. So there is a huge literacy component, I think, and I think Internews is doing a great job in promoting that understanding among journalists. But that's important to be doing. I mean, how will you report if you don't know the basics of vaccination reporting on vaccination? So that's number one. So when you understand and when you acquire that body of knowledge to be a better reporter, how safe are you? What's the institutional support that you get? Do we have COVID insurance? Is there anything like that? We expect them to do their day job. We expect to see these visuals every day on television. And what have we done as institutions? So I think there could be probably a good protocol coming out of the region, maybe, where we agree that these are the basic things that we should do to strengthen. And bolstering the coverage also means making sure that the journalists are in good hands. They feel safe, that they are able to do the work. And one thing is to not having to worry about your finances. So how can we make sure that your job is safe? So job security, physical safety, greater availability of knowledge, skills building. I think those three things go together. And since most of our countries are not going to do it alone, it probably is something that we need to discuss in a different forum and probably think as to how we do that. Maybe individual country responses are there, but I think it's really critically important that we address the psychological aspects of journalist safety, the physical safety, their incomes to be made secure. If you have to always worry, and if you're still compelled to go and do these stories and come back home worrying about being a career, and it's always a problem. And then also, how will you do good coverage? To do good coverage, you need to know, and to know, then you need to study. It's an evolving thing, just like the science, it's evolving. Our knowledge is evolving. I didn't know anything about COVID 1.5 years ago, so we are all learning. So I think it's like a string of pearls. We need to tie it up together. I'm not too sure whether I answered your question properly.
Oh, well, I think the, there's never one single answer to the question anyway. I think it does evolve for not just the one strategy, it's a variety of strategies. And I think this has been an excellent opportunity to hear what's going on in different countries, because one of the biggest challenges I think that COVID has created is the lack of movement and the lack of ability to, we've all become much more insular as probably, individually as we all work from home, but, on a broader scale at the country level, we're looking at what we're doing in our country rather than trying to learn from what each other is doing. So it's great to have this opportunity to have this discussion. I think we should wrap it up there, because I'm guessing for many of you it's lunchtime. So thank you, everybody. And thank you for those of you in Bangkok at the Asia Centre. I'll turn it over to you guys.
Thank you, Rowan, and thank you to all of the panelists, journalists here, for a very engaging discussion. And of course, thank you all for the vital work that you do. You are, of course, an important part of the human rights and democracy ecosystem.